Hello, I'm Dr.Sandeepdesai. I'm a physician from India. I am going to talk with you today about diabetes and macrovascular disease. And this is a part of my assignment that has been given to me by the University of South Wales for the postgraduate diploma in diabetes. Today we'll be talking on diabetes and macrovascular disease. Diabetes can cause microvascular as well as macrovascular disease, but our concentration will be only on macro, that is the large vessel disease. We will be talking on where the large vessels are situated, what is the prevalence of this macrovascular disease, how does this macrovascular disease occur, that is what is the pathogenesis, and about atherosclerosis. What are the risk factors causing this macrovascular disease? Can we screen about this macrovascular disease? How do we prevent or control this macrovascular disease? What is diabetes foot? And some good take-home messages. So beginning from, what is the prevalence of this macrovascular or the large vessel disease? Diabetes can cause 2 to 4-fold increase in the cardiovascular mortality than general population. A diabetic can have these complications very early, even at the age of 30 years. Women who are normally protected up to menopause, if they have diabetes, they can have more complications or the equal incidence of cardiovascular complications as men. And the death and the disability from cardiovascular complications is early and more in diabetes. Almost 75% of the cardiovascular deaths in diabetes is almost 3 out of 4 patients of diabetes die due to cardiovascular disease. Now going beyond the statistics, what is this macrovascular disease? Macrovascular disease is a disease of the large vessels. Where are the large vessels situated? They are situated in the brain and they take the supply to the brain. If they are affected, they can cause brain stroke. They are the coronary arteries that supply the heart. And if we get a block in the coronary arteries, you can get heart attack or angina. The same large blood vessels take the blood to the peripheries and the extremities, and a decreased blood supply to the extremities can cause gangrene and even amputation. So what are the risk factors and what is the pathogenesis? How does this large vessel get blocked? It is by the process called atherosclerosis. Atherosclerosis is a process in which there is a formation of plaque, which is a combination of fat, calcium and other substance in the presence of high blood glucose, which narrows and thickens the blood vessels, which gradually gets blocked in the brain, heart and the lower limb vessels, and cause all these complications. What are the risk factors causing this? There are some modifiable and non-modifiable risk factors. What are the non-modifiable risk factors? Like age, sex, gender, which we cannot do anything about. But there are modifiable risk factors. One of the most important is the uncontrolled blood sugar. Another is hypertension. The lipids or the fat or the cholesterol we say. The smoking, a diabetic patient who is a smoker gets double the risk of heart attacks than a normal diabetic non-smoker. Then obesity. So these are the modifiable risk factors which you can control, which you can prevent. Is there a way to screen for this macrovascular complication? Yes, there are certain clues, and by certain tests a doctor will tell you that you have these problems and you can prevent it. Like an ECG in a year can show you that there is a problem in the heart, and if the ECG is abnormal, then a doctor can give you a TMT or a treadmill test. The treadmill test detects the ischemia in the heart, that is decreased blood supply in the heart when you are running and an ECG is taken continuously. Similarly, a lipid profile once in a year. So all the BP once in a year. So all this makes the patient as well as the doctor aware that he is going for some complication, and he can prevent the complication by treating all these problems properly. What are these? ABC, remember ABC. If you your doctor and you can just control your A. A is A1C. What is A1C? It's the average of 3 months blood sugar. B is blood pressure. Blood pressure is properly controlled. C is cholesterol. So if you control your A, B, C properly, along with avoidance of smoking and reduction in the weight, maintaining healthy weight, you can drastically reduce your incidence of complication. In one of the studies, it has been shown that if you can reduce your blood sugar by just 1% HbA1c reduction, can reduce the macrovascular complication or the cardiovascular complication by 14%. Now, I want to talk with you about a complication called diabetic foot, which is a part of micro as well as macro. Neuropathy reduces the sensation in the foot, and along with that, if there is a macrovascular disease, that is decreased blood supply to the large arteries of the vessels, then it causes ulcer, a non-healing ulcer which can further progress, and patient can even get gangrene if there is severe decrease in the blood supply, and a person may have to get their limb amputated, which is a very disabling and a serious complication, and it can lead even to death or a future increased risk of amputation. So friends, whether you can just control your diabetic complications like diabetic foot complications, yes, simply inspecting your foot daily, washing your foot properly, always don't walk barefoot, always wear socks along with your shoes, select your shoes properly, and all this can go a long way in preventing a minor trauma which can lead to ulcer and the amputation which I said. A take-home message is, friends, diabetes is a disease which can cause cardiovascular mortality and can be very disabling. But if you know your problems well, if you control your blood pressure, if you control your cholesterol, control your glucose, and if you take care of your feet properly, if you maintain a healthy weight, avoid smoking, eat a healthy diet comprising of fruits and vegetables, and avoid certain things in the diet as seen in the diabetic pyramid, and take help of your nutritionist, take help of your dietitian, your health team, and along with diabetes, you can live a healthy, happy, and a long life. Thank you.